My name is Dr. Luis Raez. I am the medical director at Memorial Cancer Institute, that is part of Memorial Healthcare System in South Florida. And I also professor at Florida International University. I'm going to talk briefly about liquid biopsies and next generation sequencing. In a similar way as we do with tissue, now we are doing next generation sequencing with liquid biopsies. For this, we identify DNA of the tumor from the patient in the plasma, in the blood, or in urine so far. Hopefully soon we will be able to do this in saliva and other fluids. The idea is to try to help in the diagnosis of these patients for target therapy. There are several techniques for liquid biopsies. The most popular one, as I mentioned, is next generation sequencing. It's very similar to tissue, where we get a sample of tumor and we sequence the gene. But we also have other techniques. For example, we do PCR. When we do PCR, we look specifically for one specific genetic aberration. For example, the EGFR gene. And this is the advantage, for example, of PCR in liquid biopsies is the cost and the time. So that's why there are many options to do liquid biopsies. For example, for new patients that we do not know if the patient carries a genetic aberration, we may need to check 60, 50 genes, as some of the industry vendors have in the portfolio of liquid biopsies. But once that we know what genetic aberration the patient has, for example, exon 19 deletion, a very popular genetic aberration in patients that have mutations in the EGFR. Once that we know that the patient has this aberration, the patient is under therapy with a tyrosine kinase inhibitor for specific for this aberration, we maybe in the future do not need to do a sequence of the whole gene again, or look for these 60 genes again, because we know that what is going to happen, unfortunately, is that this specific aberration is going to mutate and generate a new genetic aberration that can be discovered maybe by a single investigation with this technology. That is why we have several of these liquid biopsy technologies that maybe in the future will have different indications or utilization. Another one, for example, are exosomes. When we have a cell that breaks, the cell do not necessarily is destroyed completely. Some pieces of the membrane realign because they are sticky, and they form these vacuolas called exosomes that are pieces of membrane that have realigned, and they contain sometimes pieces of DNA or pieces of RNA from the original cell. Now we have a couple of companies that have been able to trap or to catch these exosomes, and inside the exosome we can retrieve that piece of RNA or DNA, and we can investigate this DNA or RNA from the tumor and try to do next generation sequencing, PCR, or any other technology available for diagnosis of we are looking for a genetic aberration. So that's why this is a very important field, and I don't want to be too complicated, but it's important to know that these liquid biopsies have different technologies. Probably one day there will be different indications for different technologies. There is no one that is the winner for all, and this also, as I said, is available in plasma, so the patient will give us blood. It's available in urine, and hopefully will be available in saliva soon. This will decrease tremendously the number of biopsies that we have to do in the patients. That will save, also will decrease markedly the costs of the treatments. Thank you.